r/AskReddit. Doctors of Reddit, what patient made you go how the duck are you even alive? This is a smiling Kanye, it only appears once every 20,000 Kanye pics, very rare Kanye. Like in 5 seconds or bad luck. We had a guy with a major aortic dissection one night. From the bedside ultrasound, he looked like he had already bled out. He had some chest pain, but he was alert and oriented, and we were shocked he was even still alive. He absolutely shouldn't have been with how much blood we saw and the size of the dissection. We called the surgeon in, who was really blunt, and explained to the guy he was probably going to die in surgery. He was a young guy, like late 40s, he was on a business trip, and it was completely unexpected. He kept trying to call his wife, but it was like 2 a.m. and she wasn't answering. He just wanted to talk and tell her goodbye. It was actually pretty devastating to watch. Meanwhile he's so coherent and alert as if he isn't actively bleeding out and dying. Most patients we would get in the same situation wouldn't be conscious or would already be dead. They swooped him off to surgery before he could contact his wife, and the dude lived. Remembering that story got me through a lot of tough years in the ER, because I think it just reminded me that hope and good outcomes are still out there. Edit. Geez, this blew up. I picked up my phone this morning and had no idea what happened. Thanks all for the awards and the interesting discussion. To those of you with similar stories, know that you are the reason a lot of providers keep doing what they do. Some of your experiences are unbelievable. I am still trying to read through all the comments. To clarify some things. Late 40s is young for this kind of case to happen. We usually see people dissect in their 70s to 90s. Also late 40s is a pretty young age to die, especially if you don't have any chronic illnesses. A couple of weeks ago, my Ed lost a 30-year-old to COVID-19. A couple of nurses cried because we consider people twice his age still pretty young. This happened when I was still a tech and had only been in the ER for about a year. He was brought in by EMS uncomfortable, but definitely awake and alert. His ECG was normal, and he didn't have any pertinent history, just chronic HTN and a few minor surgeries. But he was hypotensive and really pale, and when we performed in US, we found what looked like a huge volume of blood in the abdomen, and a visible intimal tear. We pretty much immediately diagnosed him with AD and had vascular surgery in the room within a few minutes. I followed up on his chart a few days later and found out not only that he was alive, but he was already extubated and able to walk. I'll try to keep sorting through comments. I am surprised that this isn't as uncommon as I thought. My favorite bit about this story is you called someone in their late 40s a young guy. As feel good as this story is, you've just made a bunch of other random people very happy. When I turned 30, my little brother told me don't worry about it, if your life was a Wikipedia article you'd still be in the early life section. That actually helped a lot. Patient here, when I was 7 I had horrible asthma, my mom often lied in my bed with me and listened to my breathing. One night she fell asleep and jerked awake in the wee hours of the night, and found I was not breathing. Goes to the ER immediately because it was only like 10 minutes away. Not sure what happened while there, what tests they did, but I was declared dead. In the morning I woke up, asked who I believe was a nurse where I was, and she started crying and called in my mother, who hadn't slept all night. The doctors said they didn't know how the duck I was still alive. Now 16 and haven't had any hospital-worthy complications since. And god damn it, my mom is the most amazing and loving person on this green earth. Edit. Since a lot of people are asking, I had been decidedly dead for about 10 to 30 minutes, which is why I wasn't transported to the morgue. Everything else in this thread is just incredible odds that someone somehow won. But how the duck did you wake up again? Probably had a very faint heartbeat that they didn't detect. Currently in residency, but this was a patient I saw in medical school. This one has more to do with a patient's past medical history instead of anything acute. Had one patient in one of my internal medicine rotations who was admitted for hip surgery who was one of the nicest, sweetest people I've ever met. Her surgery was pretty routine and there were no complications. In her past medical history, she was diagnosed with stage 4 endometrial cancer that had spread to her brain. Apparently she had undergone chemo, radiation, primary tumor resection, and surgery to remove the brain met. She remained cancer-free since that period. The fact that she had undergone that whole ordeal and appeared to be mostly healthy and was in remission from her cancer really blew my mind. I work in trauma and once had a guy fall off a roof. He said he remembered hitting the bars on the scaffolding on the way down. We originally thought he'd fractured his femur, but nope, just a small hematoma. He was in bed next to a man who had broken his ribs and had a small C-spine fracture when he fell forward picking up his keys. The duality of man. One of these men ate his vegetables. A guy the first took care of during my residency. Ducking cyborg. I was the chief on trauma. Got a page about a patient en route with a stab wound to the chest. When the patient rolled into the trauma bay, he had no pulse. He had been stabbed in his left upper chest 3 centimeters below clavicle. He got an orthoracotomy. If you want to feel like a badass, then do an orthoracotomy. We were able to cross-clamp his aorta. We took him right to the OR. We oversewed one small artery below his rib, then transported him to the ICU still intubated. 8 hours later he was extubated and wanting breakfast. Seriously, dude? He was dead 10 hours before. He was also a complete asshole. No wonder someone stabbed him. Nurse turns to the doctor, can we unsave this one? Where's the unsave button? As a med student on my emergency rotation, I had a guy brought in who had fallen off a 7th or 8th floor balcony and landed on his head. Essentially DOA, and we couldn't get a blood pressure when he got to the hospital. As a student, my job was to basically stand to the side and squeeze the bajillion bags of blood that went into this dude. His cervical spine was essentially dust on the initial CT scan we got. I figured he probably wouldn't have made it, but about a month later I am now on my ICU rotation and I see this guy awake and conscious. Pretty crazy. Any update on his condition? Crazy. When I saw him we were basically seeing how much function he would get back, but he was going to be in the ICU for a long time. From what I can remember he couldn't really move either leg, but he actually had some movement in his arms, hands, so they weren't sure how much he was going to get back by the time he left the hospital. Lady in her mid-30s was in the clinic for a 1-week follow-up post-foot amputation, diabetes. She was admitted straight from the clinic because her blood glucose was 600 mg per deciliter, normal is 80 to 120, and the wound was severely infected. We used super concentrated doses of insulin to bring it back to the 200s. She was on strict diet restrictions and we couldn't figure out how it wouldn't drop any lower than 250. Turns out her kids, teens, had been sneaking giant 64 ounces sodas and candy bars into the hospital, literally 1 week after we chopped her foot off because of uncontrolled diabetes. Not exactly a case of how the duck did you survive that trauma, disease, but how the duck do you even function on your own? My wife's father died due to diabetes complications. He'd been in and out of the hospital for several years. He went in on a Friday, they amputated toes on Sunday, he was dead on Monday. Nobody was prepared, but nobody was surprised, either. When we went to his apartment to clean it out, and there was candy everywhere. Under couch cushions, pillows, in his bed, in all of the cupboards. I have a sweet tooth and I can't imagine wanting this much candy. The man killed himself. I was on home call for in a small town, got a call from the nurse one night and she was like, "Ems brought someone in here and they think she might be dead?" I was like, "Well, is she?" She was like, "I don't know." This was a seasoned RN, by the way, so I was like, "Well, guess we're treating this as a code blue kind of situation," so without any further information, I jump into my car and rush over to the hospital. Once I got there, I realized why the triage nurse was so confused. In the trauma bay, lay what appeared to be skeletonized remains under a blanket. The person felt warm to touch, so I opened their eye, and a yellow, wrinkled, shrunken eyeball stared at me and then suddenly moved. Potassium of 1, for those familiar with lab values. The backstory was extreme self-neglect, depression combined with caregiver neglect. Weighed in at 67 pounds at a height of about 5'5". We actually resuscitated her, very aggressively, and unbelievably, after about 8 liters of fluid, she started speaking a word or two at a time and recognized her daughter. For those like me who are curious, potassium levels of 3.6 to 5.2 is normal. Anything less than 2.5 is life-threatening. Seems like a relatively wide range for normal, but it doesn't take much to get into deadly territory. That's kind of scary. I'm going to go eat a banana. I have a hospice patient that has been on our service for 4 years. I am either really great at hospice, or really bad at it. My great-grandma went to hospice because she was no longer ambulatory, needed help using the restroom, losing weight, etc. A month in, her nurse comes in to find her in the restroom on her own steam. This was paired with a marked weight gain. Turns out the nursing home food was crap, so she just wasn't eating enough, but the hospice facility let her have salty, buttery pierogi and kielbasa again, so she started eating. During residency, my ICU patient had to have his chest reopened less than an hour after 6-hour open-heart CABG surgery. He needed 12 units of blood, his heart massaged then shocked 4 times. Cardiothoracic surgeon in the ICU operating because no time to go back down to OR. Was an illicit drug abuser and alcoholic. Nurses called him the cockroach. I checked in on him for 4 weeks. He was unresponsive every day. On week 20 we had to consult and to take maggots out of his nose. I was sure he was a goner after that. Week 3 passed, no change. Week 4, day 24 I believe, at 6 a.m., he opens his eyes. I was shocked. He has a permanent track and ostomy now, but somehow is alive. How the hell did he get maggots in his nose? Question mark. I am not that poster, but I'd assume drug abuse. I shadowed an SLP in an ICU one day and we had to do a cognition eval on someone who had overdosed on what his chart called a variety of drugs. I forget exactly how I found this out. I think he was alert and told us, but had done so much cocaine that he didn't really have a soft palate anymore. It had just dissolved away or something. I am really not acquainted enough with drugs to say for sure. Edit. Remembered it wasn't a cog eval, he had been intubated and we were doing a speech-swallowing screen. EDIT2. People are asking how this means maggots. I can only assume that perhaps when he was asleep or passed out one time a fly either flew in or smelled the dead tissue, and figured its children would love to eat that. You'd have to ask the top commenter, to be sure, though. My mom's a doctor. I asked her about this when it came up on Reddit. When my mom was in her cycle during internship, man with police officers behind him came in the The man was perfectly fine and walking, so my mom and her colleagues were confused. The officers showed them a picture of a crumpled metal piece, which was a car. It didn't look like a car at all, just metal trash. The officers told my mom and her colleagues that they rescued the patient from the car, which was lit on fire only a few seconds after they rescued him. The patient didn't have a single scar on him, was perfectly fine, and got his name around the hospital for being immortal. My siblings and I all walked away from a car crash where our hatchback flipped upside down and backwards on the highway. Car was totaled. Ambulance guys couldn't believe we'd walked out of it. Seatbelts save lives. My mom and my sister did the same thing, in a car that was over 10 years old. My mom had the satisfaction of getting out of the car and screaming bloody murder at the teenager who blew through the stop sign and T-boned them. That kid got a double whammy of thinking she'd killed people and then getting yelled at by a crazy person. Patient here. When I was 2 I was being treated for asthma due to wheezing, labored breathing, etc. One night it got exceptionally bad, so my mom took me to the They put me face down to do a CT scan, this was 1990, and when they were done, they turned me back over and I was blue, had stopped breathing. CT revealed a volleyball-size mass in my chest. Emergency surgery revealed what was supposed to be my twin. It kept growing inside my rib cage and finally had nowhere to go in my toddler body, so it cut off my airway. It had fingernails, hair, appendages. Everything but major organs. I made a full recovery. I am a healthy 31-year-old now. Zero asthma. Only remnant of that night is a scar that goes from the center of my chest to the center of my back. Update. Definitely didn't expect this to blow up. Damn. Thanks for my first gold. This was a teratoma, so it was never a viable human. Edited the post to show that I am the healthy 31-year-old. Lol. Anybody that quoted Dwight Schrute is my hero. What? The duck. Yep, it's called fetus in fetu. Veterinarian. Dog hit by a train. It severed the dog's leg and the dog carried its own leg home. Owner brought dog and leg to the Edit. Leg could not be re-attaches due to significant damage to limb. Dogs do great as tripods though. Imagine seeing a 3-legged dog running with a leg in his mouth. I guess I would think something like damn, catch is getting extreme. Dog was probably thinking, well, I gotta get home, but I'm not gonna leave this perfectly good bone behind. My dad is 87, he had prostate, liver, bowel, colon and skin cancer. For the skin cancer he had lots of reconstructive surgeries. His whole tibia region and the back of his hands. Every year he has to have at least one skin lesion removed. He had a couple of heart attacks and then a sextuple bypass surgery. He also had a big pneumonia, a huge abscess and a small stroke. His doctor wants to see him every 6 months. I think just to be amazed that he's still walking around. If I were a doctor or scientist duck every 6 months, I'd want to see this guy weekly so I could study him and give other people his immortality. I dunno man, if immortality comes with those side effects, I might pass. Obligatory not a doctor, but my dad is and he liked to tell us about the crazy crap he saw. This post made me think of one of those in particular. Huge guy, linebacker build, came into the trauma ward with a gunshot wound dead center of the chest. He could breathe fine and he had a pulse. So they did a chest x-ray and found that the bullet had spent all its energy getting through this guy's sternum and was just resting on his pericardium. Strong bones. Natural armor. You think he still qualifies for R, never broke a bone?